go into this business because you care about people. And our staff, while they did all this great work, I also want to reiterate that, they're hurting too. This is tough on staff. We've actually seen tremendous outpouring from the community supporting our staff. That is very heartfelt from our standpoint. We appreciate that very much. It means a lot to our team that this community has reached out and supported them. Want to introduce Dr. Mark Steele. He's going to give an update on the condition of the victims that we received, and then we'll let him introduce one of our trauma surgeons. Dr. Steele?
Right. Thank you, Charlie, and good afternoon. I'm very pleased to report that of the 8 gunshot wound victims that were received, 5 of those were dismissed from the emergency department last evening. 3 individuals remain in the hospital. 1 is in stable condition. The other 2 were admitted in critical condition. They remain in critical condition in our ICU, but they both are improving, so that's good news. It's my pleasure now to introduce a couple of our outstanding trauma surgeons, Dr. Dustin Neal, who serves as medical director for our trauma program, and Dr. Anu Shaw.
Hello, I'm Dustin Neal. I was told to spell my last name. It's N-E-E-L, and this is Anu Shaw. I don't know if you spell your name or not.
I don't know. My last name is Shaw, S-H-A-H.
So, as Mr. Shields and Dr. Steele mentioned, we're a level 1 trauma center. We just finished our recertification in December. We were the first level 1 trauma center in Kansas City, Missouri. And one of the big things that the American College of Surgeons wants is to know what our mass casualty plan is. We go through that during the survey. We talk to the people who help maintain it. And we practice it, as I'm sure you all are aware. We have a mock mass casualty trauma every year that's citywide. And mock patients come to us from various sites, and we practice this so that should an event like yesterday unfortunately happen, we're prepared for that. The thing that makes us special is the medical director of KC Fire is also an emergency medicine physician here. She was at the scene and was able to triage these patients appropriately, very quickly and efficiently, which ultimately allowed the sickest people to get to us first, as we're the closest hospital. The first person who arrived, as Dr. Steele mentioned, that's in critical condition, had he not made it here as fast as he had, he might not be with us now. He sustained extremely life-threatening injuries, and fortunately, thanks to Dr. Carney's triage, our KC Fire and Police Department, he was able to get here quickly. He was the first person here, and our mass casualty plan then went into effect and got him straight up to the operating room, and we're able to stabilize him. And as Dr. Steele mentioned, he has improved overnight despite his life-threatening injuries, with plans for future operations today, and hopefully he'll continue to improve. Dr. Shaw?
I want to reiterate that we did have excellent coordination between KCFD, KCPD, and they did a phenomenal job on scene with their disaster response. Their coordination with University Health has allowed these patients to survive. We're very happy to say that we didn't have any deaths in the hospital. Unfortunately, there was 1 death from this event. But those that were critically ill were able to get to us in a timely, efficient manner so that we could provide care to them. And so the coordination between all of the departments, citywide, between all the hospitals, especially with University Health, allowed for our disaster response to be as robust as it possibly could be.
You spoke about 1 patient who is in critical condition. Can you talk about the other patient that's in critical condition? What's happening with them?
The other patient who was also in critical condition was the second patient who arrived to us. Fortunately, she was more stable than the first patient, but ultimately did have to go to the operating room as well. She is recovering in the ICU and improving. We're hopeful that in the next day or 2, she will be able to be moved from critical to stable condition and get out of the ICU. But again, a lot of it has to do with the coordination between KC Fire and the triage at the scene. to get her to us next, because the people who came first and second were the ones that had to go to the operating room, and that's what you want when you triage, because the ones that need to be saved need to get here first. The ones that need an operation, need to get here first.
Can you provide us a little more detail on the nature of their injuries, or just some specifics about those two that you're critical?
All I can say with HIPAA and everything else is that the first patient sustained an injury that is 90 plus times lethal. And fortunately, again, with the coordination, was able to get here quickly and was able to get control and repair and stabilize in an efficient manner. The other patient also sustained an an injury that required operative intervention. But as far as the specific details with HIPAA and everything else, I'm not going to speak to that.
What does 90 plus times lethal mean? Like
90% lethal, meaning that if 90 people or 100 people were injured with this, 95 of them 95 to 99 would not have made it or survived the operation.
And do you know the exact time from between when this patient was shot and when they got to the hospital? How long was it before they were on the operating table?
From the time that they arrived to us, the patient was in the operating room within 5 minutes.
Do you know how long it took them to arrive to you, though?
I don't. With the injuries and then the scene time and then securing the scene and making it safe, I don't know how long that was. But Dr. Carney saw the patient and picked that patient first to come. And so because of that, that's the reason that he came first and was able to be taken directly to the OR. One of the things we're most proud of is the American College of Surgeons tracks a whole host of numbers and statistics, and one of them is time to the OR. And from the time that the patient arrives in our OR, our average is less than 12 minutes. The best we've ever had is 3. The national average is less than an hour. We're in the top 1% of the nation as far as getting to the operating room upon arrival. And that has to do with the training of the staff, our operating room, our nurses, the emergency medicine department, because once somebody's identified that needs to go to the OR, we get them up there, because the faster we can get them up there, the faster we can stop the bleeding and save a life.
And the ages of those 3, male, female, which is male?
There's a young gentleman, I don't know his specific age, and then there's an older lady.
Like when you say young, you mean like less than 18, less than 16?
We believe he's over 18.
Okay.
But again, he's still in critical condition, and so exact ages and things we have not identified. Everybody comes in as an alias so that we can rapidly take care of them, because they're all pre-programmed in our system, so we can take care of them without having to enter them into a computer.
And you guys don't do any children here?
We do take care of children, although as you can imagine, most of them come across the street. We do take care of anything 13 or over. Under 13, it's an American Anesthesia Society issue that has to be a pediatric center. Anything that gets brought to us, we will stabilize up to the best of our ability, including operating on children if we have to. But we do not accept them and transfer, or if EMS knows their age, they don't bring them to us. But if they look like an adult, anybody over 14 can stay here.
And after everything that you saw yesterday, are you surprised that only one person has died so far?
I don't know all the details of the specific event as far as what happened. I'm not surprised that our care went the way it did because of the way that we train for it. We've been a trauma center for a very, very long time. As I've mentioned, a lot of people know that if they're hurt, that they need to come to see us, because again, we're an efficient trauma center to get you to the operating room if that's where you need to go. Once they get here, they have a chance to survive. So I'm not surprised that with our team, they were able to save all of the patients. As far as the overall number of patients that happened during the event, I don't know all the specifics of the event to be able to say how many there should have been or anything like that.
Are there any patients that arrived without gunshot injuries?
There are. Unfortunately, as you can imagine, during the exodus after the event, there are patients who get caught in the exodus We've had a few people who injured various extremities and have some broken bones that were due to trying to get away that weren't actually injured from gunshot violence.
Are you guys still treating actively any non-gunshot patients right now?
There are a couple who are still in the hospital. One is awaiting an operation and one is planning for discharge later today.
They're all considered stable at this point.
Got it. Okay, so the 3 people who are still in the ICU, those are all gunshots.
2 in the ICU, 1 that is stable on the floor, but those 3 are, yes ma'am, all penetrating trauma.
When you said, so of the 8 gunshot victims, you said 5 were dismissed from the ER. Are they still being treated elsewhere in the hospital, or have they been discharged?
They've been discharged from the hospital, from the emergency department. They were able to go home.
Okay.
You guys treated people on the scene as well at the rally. Were those same medical staff then treating people at the hospital, or can you describe, I guess, the team care that went into it?
So fortunately, again, as with Dr. Carney, in our close relationship with her and KC Fire, some of our nurses and medical staff are able to, as Mr. Shields mentioned, there to help take care of planned intoxicated people or minor injuries. And so we have at every event at Union Station or big event, a lot of our nurses and emergency medicine providers will be at those events to help take care of people. They're obviously not planning to have the event that they had yesterday, but fortunately with them there, they were able to help start the triage and treatment process. They did not come back to work and take care of people after the event, mostly because all of the patients that arrived had already been taken care of. I don't know if they are at work today, but I would assume with the resilience of our staff and the desire to continue to take care of people, they are probably here if they're scheduled to work.
And go ahead. Last question?
Yes, sir. Just you guys are pros, of course, at this, but I wonder if you could just share some thoughts in this age of mass shootings. We see these all over the country more and more. Just your thoughts on that and the fact that this stuff seems to be happening, sadly, at a regular pace.
It's hard for me to speak from any sort of overt political view. Every time we have one of these mass casualties, it's a tragedy. And I agree with you, they've become so frequent that unless it is a national story, a lot of times we don't hear about it. As the news mentions often, we do see a lot of high acuity injuries, whether that's from penetrating trauma, car wrecks, motorcycle accidents, bad falls that do need emergent care, and we train for that. But those patients aren't making the national news, but we are taking care of multiple victims on a fairly regular basis of high acuity, meaning without intervention, high chance of not surviving on a daily, weekly basis. And so I agree with you, it's hard to speak about, but every one of them is a tragedy, whether it makes the news or not.
Thank you guys very much. Thanks for coming. Thank you for being here.
And the ages of the people that you guys...
We don't have ages right now. No,
ages,
sorry.
but they're all adults.
Yeah.
All right, so you were taking a live listen as UMKC hospital officials were providing an update as it relates to the patients that they received following the chief's mass shooting. This happened, of course, after the victory celebrations yesterday. So the update is as this: one patient was brought to them in critical condition. All we know that about this patient was that it was a male patient, but you heard from the hospital official right there that this male patient 90% of the time would have died from his injuries. However, the hospital officials were saying the training and protocol and the quick response saved this patient's life. We also heard about a second patient in critical condition. She needed surgery. Anyone under the age of 13, they were explaining, has to be taken to a pediatric center. So this hospital, UMKC, was only receiving adult patients. The hospital official also said that they received a number of patients with broken bones. This was not directly from the shooting. However, these people sustained their injuries trying to flee the scene yesterday as that gunfire rang out. A number of people are still in the hospital at this hour. One is expected to be discharged later later today. The hospital official also explaining that a number of nurses and medical staff were actually at the celebration itself yesterday to take care of any medical emergencies such as inebriated fans. Certainly not expecting this level of emergency. However, they were able to start the triage process at the scene. And again, that is one reason why the hospital says that lives were saved because of the training and protocol and the quick response time by medical staff.